Hello, hello, hello to everyone. I hope I'm audible, visible. Hello to everyone. I hope I'm audible, visible. I think, yeah, I'm audible, visible. Yes, it is going to be a great session today. Please join in. Hello, hello, hello to everyone. Hello. Today we are discussing anesthesia and it'll be a very rocking session. So I want everyone to join in and be there with me so that we can, yes, do the subject. Class will be, yeah, the PDF is same because obviously, yeah, how can concept change? Okay, so concepts have not changed. We have just added some new questions which are from the recent INSCT or other exams. So we have just adding the questions from the exam. Okay, not information. How can anesthesia change? Lignocaine will remain lignocaine. Sodium channel blocker will remain sodium channel blocker. So subjects don't change. Okay, what happens is updates, like maybe there's some classification which has been altered or some new guideline which is there. So that's why 19% things remain the same, 1% might change. Anesthesia, there was no, yes, this session will be available online. You can watch it anytime. Hello to everyone. Dr. Rana, Prem. So how are you all? What are you doing? I hope, yes, obviously it is for NEET PG sufficient, more than sufficient. All the 5-year questions of NEET PG INSCT are included in the PDF. PDF is there in the group. You can check all the findings. What are the differences? What are the layers, pairs? Again, all are questions. Okay. What are the side effect? What is the epidural anesthesia? Everything is there. Okay. Clear? Wait for patho session also. We'll do patho also. So please watch patho also. Hello, hello to everyone. Okay. So everything will be discussed. Don't worry about anything. This is what we are discussing. Everything we will discuss, and I'll give my own style to make it easy for you to remember, recall, and so don't have to worry about that. Okay, we'll do all 19 subjects. Okay, so yeah, it is for both the exam, FMG exam and the NEET PG, because the question bank is same. Most of the questions which are asked in the NEET PG, FMG questions are almost similar. I have seen same question asked in both the exam. Like there's a question on the meningitis, exact same question. Cobweb were there and TB meningitis was the answer. So again, you don't have to do anything. Yeah, please attend. Okay, clear? So be strong, be positive. There is nothing to worry about. Everything will be great. Just be positive and keep doing it. See, so this is all the topic which are asked, and this PDF cover everything. 27 pages will do in 2 hours, and it will cover each and everything which is asked in the exam. Okay, depolarizing, non-depolarizing, shortcuts, how to remember, what is curonium, curiums, all, what are the differences, all we are going to discuss in the session. Okay, all this intubation, all the, yes, things. Okay, so I think we will start. Should I start now? Okay, so let's start. It's almost 7:02. So let's start. Let's learn. Okay, be positive. Yeah, so everything. Okay, like Mallam Patti score, again it was asked in both NEET PG and FMG exam also. So everything we are discussing is going to be discussed. In this case, I'll just tell you the tricks, how to remember that was missing, what is added. All these things is our today's priority. Okay, so let's start without any delay. Okay, so thank you for everyone for turning in and coming in. Yeah, thank you, Dr. Mino Ketan Pradhan. Yes. Okay, yeah. Okay, so let's continue. Let's start. So first is, what is anesthesia? Anesthesia means sensation. Anesthesia means loss of sensation. So anesthesia is basically anything which cause a loss of sensation. Okay, loss of sensation. And World Anesthesia Day is 16th October 1846. Why? Because this was the day on that the William T.G. Morton demonstrated the effect of ether as an anesthetic agent. So that's why the mnemonic is Mortin make what? Mosquito unconscious. And T.G. Morton made human unconscious. So remember, for human it was T.G. Morton, and for mosquito we have Mortin. So Morton 14 is the mnemonic, and was October this. You can remember 2nd October is Gandhi Jayanti and Gandhi जी 14 याद है, चिल्ड्रंस डे नवंबर, तो 2 और 14, गांधी जी 2 अक्टूबर 14 16 आ जाता है। तो नेहरू का कितना, चाचा नेहरू का 14th November. So you can remember 2 and 14 16. So 16 October is the World Anesthesia Day. Okay, thank you Dr. Abdul. Yeah, we'll do all the 19 subject. Some subject I'll do in single session, so you can watch the previous session if you want to do it faster than before. Okay, let's continue. Now there are two kind of anesthetic agents. One is general anesthesia, one is regional, or you can say local anesthetic. The main difference is the loss of consciousness is seen in general anesthesia. So general reaches the brain, it crosses the blood barrier and it shut down the higher centers of brain, and that causes you to lose the consciousness. Whereas local anesthetic don't cross blood barrier. Why? They are highly polar compounds. They are very polar nature. So that is why they don't cross the barrier. Now, local anesthetics basically cause loss of sensation from the specific area, like we are doing a nerve block. So that area supplied by the nerve is going to be losing the sensation. Okay. So mechanism is they block fast voltage gated sodium channel. So no action potentials, and without action potentials, no information can reach the brain. So you lose the sensation. Now remember a very simple mnemonic, amides. Amides have two I's. Amides are I and I. And ester, E, only one E. Ester is only one. So that's why if they ask you classification, if there's double I, like lidocaine, prilocaine, articaine, answer is, it is amide. Amide is 2. Ami is 2I, and ami. And ester is only single. Benzocaine, cocaine, procaine. Okay. Now, most commonly used local anesthetic is our lidocaine or lignocaine, which is the commercial name. It is also called as xylocaine in the commercial preparation, used with vasoconstrictors like adrenaline. Why? It increase the duration of action. Why? Because adrenaline causes vasoconstriction. So LA will stay in the site for longer time. So increase the duration. Plus lignocaine is excreted by the kidneys. It's very short acting, but only thing is very short acting. It is short acting. That is why if you need a longer acting one, we can use dibucaine or we can use the bupivacaine. But side effect is cardiotoxic. It is cardiotoxic in this case. Okay. Koi nahi, I'll do the medicine also. You can do medicine with me. Okay. Now let's see the structures pierced during the spinal anesthesia and also during the lumbar puncture. Remember mnemonic is sa sa liga dab. Sa sa liga dab. Sa sa liga dab. So sa sa liga dab. Liga is ligament. Sa sa liga is ligament. And the mnemonic is, yes, supari in, flavor out. Flavor. So supari goes in the mouth and then you get the flavor. So ligament. So supra, in for inter, flavum is the flavor. So what are the three ligaments? They are supra, inter, flavum. So supra, inter, flavum. And what is the sasa? It is skin and subcutaneous tissue. So sa is skin and subcutaneous. Then we have the three ligaments. Which one? Supra, inter, flavum. Supra, inter, flavum. And once you pierce the meninges start. So the three meninges, this is dura mater, dab, arachnoid mater and pia mater. So that is why there is first epidural space just outside the dura. Then we have the arachnoid mater and then we have the subarachnoid. So remember, where do you do epidural? It is here we do epidural anesthesia. And this is the subarachnoid space. Here we do spinal anesthesia. So subarachnoid is for spinal anesthesia. So they will ask you this question, what structure is pierced before you enter the epidural space? Ligamentum flavum pierce, then you enter the epidural space. Clear? So that is the case. Yeah, it is there. Don't worry. We'll put in the, every place. Okay. Yeah, lecture will be available here and the full playlist I will upload in the channel that you can watch later. Okay. So 200 are live. Thank you very much for all the students who are watching and this. So let's ask you question. Should I ask you questions? Okay. So let's do the question sessions. Okay. So question for you. Okay. What is the sequence of the structures pierced? What are the three ligaments? Thank you, Dr. Dikshit. What are the three structures? Three ligaments. Yes. What are the three ligaments? Give the mnemonic. Three ligaments. What are the three ligaments? Anyone? Three ligaments. What are the three ligaments? Supra, inter, who's the last one? Yeah, supra in, supari in flavor, supra in flavum. Very good. And what come after phlegm? We have the DAP. What is DAP? Is meninges. So what come first? Epidural, dura. What come after dura? Arachnoid. And then come our pia. So where do you give? This is subarachnoid. Subarachnoid is CSF and we do spinal here. Very good. Very good. Okay, perfect. And where do you do? Epidural. This is your epidural. Okay, so here we give epidural. So please remember the question. What is pierce for epidural? Ligamentum flavum. So there's a fall in the resistance. The moment you pierce the flavum, the resistance fall, and that means you are now in the epidural space. Done? Okay. Next question. Okay. So if you inject the GA here, it is called as epidural anesthesia. It is spinal anesthesia. Who will be more potent, more area of distribution and less dose? Obviously, spinal will need less dose because yes, it is going to be what? Directly acting on the nerve roots. It will need more dose. Okay. So need more dose, less area. It will be needing less dose, more. But remember, it also causes CSF loss, and CSF loss causes headache. And there's a high risk of hypotension in this case. Also, hypotension risk is high. So hypotension, headache is more in spinal. So spinal, hypotension, and this. Okay. Thank you, Dr. Vishal. Okay. Let's go back. So now comes the question. Okay. Spinal, more potent, obviously, but causes hypotension and headache due to CSF leak. Uses prostate surgery we can do during delivery, labor we can use, or limb surgeries we can use. So it will be used for all this operation in which you are getting lower body to be anesthetized. Now it is not used for aortic cardiac surgery or organ transplant, etc. Okay. Next question. Epidural is below umbilical surgery. So what is the procedure? Below umbilical surgery, like again lower limb, etc. we can use this. Okay. Site is thoracic or lumbar vertebra and pierce till ligamentum flavum. Okay. It is subdural space. Okay. And finally, the needle uses Tuhi noodles. Okay. Tuhi. And next is does not cause hypotension and shock. Analgesic effect is also there. Increased doses needed. Okay. Now come general anesthesia. What it can cross? It can cross blood-brain barrier. So cause loss of consciousness. That's a very important finding. And it is the one which is used for the surgeries in the cardiac cases or in the brain. So these are the ones which are using. Example, laparoscopic surgery, renal surgery, neuro, CABG, transplant. We all do it using the general anesthesia. Now remember, all the GA, general anesthetics, act via GABA except ketamine and xenon, which act through NMDA, that is glutamate antagonism. So NMDA is excitatory and it is blocked by ketamine and xenon. So remember, kisne kata? X ne kata. X cut you. So X cut mine. X cut mine. So mnemonic is X cut mine. X cut mine. X cut mine. Very, very important. Yes. Next is components. So remember, what are the components? First is loss of consciousness. Very important. Then loss of reflex. If there are reflexes, you do incision, patient get the pain and he will kick you. Remember, so pain cause withdrawal reflex. So don't want the person to move. Then amnesia. Remember, if the patient remember that what you do, he might learn and then he start doing the surgery. So इसलिए memory नहीं होनी चाहिए. पता लगे वो खुद ही करने लग गया. कैसे? अरे मैं तो सीख लिया डॉक्टर. अब मैंने सीख लिया. ऐसे करते हो तो ऐसे आप स्टोन निकाल देते हो. तब तो मैं खुद भी सर्जरी कर लूंगा. So that's why no memory. ताकि उसको याद ना रहे हमने क्या क्या किया या क्या क्या बात कर रहे थे हम. ठीक है? He should not listen to us also. Muscle relax. Otherwise, how will you proceed? So the muscle should be relaxed. And finally, no pain. Imagine patient is having pain. And now he can't move the body because muscles are paralyzed. Very dangerous condition. Now steps of GA. So the steps of GA. So first is we give 100% oxygen to prevent hypoxia. Then we do induction, that is Dalo. Then maintain, continue, and then reversal. Reversal means you stop the GA and now the person recovers consciousness and he's gaining back his consciousness. Okay. So agents we can use is flumazenil, which is a GABA antagonist. Also use in benzodiazepine. Antidote is फ्लूमाजेनिल. सो फुल मजा नील, सो पूरा मजा नील कर देता है, ठीक है. सो व्हाट इज द एजेंट? IV और इनहेलेशनल एजेंट. मोस्ट कॉमनली वी यूज अगेन दिस केस propofol. Okay, then inhalational agent and continue GA. Now remember what is TIVA? TIVA is total IV anesthesia. That means both induction maintenance by this. That means both induction and maintenance by same agent. Okay, volume I'll increase, don't worry. I'll go to volume. Okay. So I hope is now audible, loud, clear. Is the voice now clear? Please give me a thumbs up. Is the voice now clear? Yeah, I think it's increased. Okay. So both induction and maintenance is done by IV agent. Example, propofol. So example is our propofol. So propofol can be used for our, yes, TIVA. Now pin index system. Now remember, when you're connecting a cylinder containing the gas, okay, you need to make sure that it corrects rightly. Otherwise, it will cause a wrong cylinder to be added, and which could be, lethal. So that is why, how do you make sure the cylinder is connected to the right system? That is by our pin index. Imagine we have pin in mobile phone. Imagine we have pin in relationship also. How beneficial will it be? What do you say? If there's a pin system in relationship, will it be beneficial? What do you say? Yes or no? What do you people say? Pin system, okay? Only right connection, no other connection is possible, okay? So I don't know what your comments are, okay? So I think people who want dedicated, sincere relationship, they should have a pin code, not a pin which anyone can put in and connect, okay? So some people have multitasking pin which can fit with any cylinder, okay? Okay, chal. Now I'll tell you very simple mnemonic to remember. First, so I'll write the mnemonic, then I'll come back here, okay? So remember mnemonic. Remember 5, 6, 7. 5, 6, 7. 5. So how many? First 5, 6, 7. 7th is which day in the week? 7th day is entertainment. Shaktiman, Shaktiman. So we get entertainment. So 7th day is entertainment. Antonox. So Antonox is number 7. Antonox is number 7. So ये क्या है आपका? Number 7 is Antonox. Okay. And what is Antonox made by? N2O, nitrous oxide, and ox, and oxygen, and oxygen. So what is it made by? Nitrous oxide, N2O, and oxygen. 50%, 50. So don't forget, Antonox is 50% and 50%. 50%, 50%. Yeah, we'll do big subject soon. I'll give you a schedule tonight once I go through this, okay? Yes, more than sufficient, bhai. More than, इससे ज़्यादा क्या पढ़ोगे? 5. How many elements are there? 5 elements. 5 elements, okay? Panch tattva. So right? 1, 5, 2, 5, 3, 5. 1, 5. First element is air, in which we breathe. Air. So air is first element. What is the most important gas in the air? Oxygen, O2. And then what is the remaining gas? Is nitrogen or nitrous oxide will take? N2O. Now if you are smart, you can see one very special thing. See, air has 1, so 1. Oxygen has 2, so 2. Nitrogen is 2 here or 1 here, 3. So that's why N2 and O1. So it becomes total 3. So air 1, oxygen 2 and 3, 5. Air 1, oxygen 2 and 3, 5 is this. Yeah, we'll cover all important subjects first. Don't worry, okay? Yeah. Chal. So let's continue. Let's do it, okay? Now 6. What is 6? Remember 6 is 3 C's. 3 छक्के. तो याद करना 3 छक्के. 3 छक्के. So 1 छक्का, 2 छक्के, 3. 3 sixes. Now 3 sixes. Imagine 3 sixes on a bicycle. 3 sixes are traveling on a bicycle. ये bicycle है. 3 sixes. साइकिल पे. तो 3 छक्के साइकिल पे, साइक्लोप्रोपेन. So 3 sixes on a cycle, cyclopropane. 3 sixes on a cycle, cyclopropane. Very simple mnemonic. 3 sixes on a cycle. 3 छक्के साइकिल पे. So cycle पे 3 sixes imagine, and this is cyclopropane. Okay, now 1626, both are carbon dioxide, CO2. So it is CO2, 1626 carbon dioxide, 1626 carbon. Only thing is it is more than 7% CO2, it is less than 7% CO2. Some books give it reverse, some books say it is less than 7%, 26 is more. Again, I don't want to go in controversy, I'm using it the notes of faculties, and that's why I'm taking it. Okay, remember CO2 cause pollution, so the color gray color, so it is gray color. Cyclopropane, see the word propane, oprane, oprane, propane, oprane, so sound like orange, orange, so it is orange color. So what is propane? Orange, orange color. So cyclopropane, oprane, orange, oprane, orange, oprane, orange. So the color is orange color is the color. So the color is orange color. Are you clear? Orange. What is gray? This. Now let's do nitrous oxide is sky. So what is the most important gas in our atmosphere? Nitrogen, na? So sky is what? Blue. So it is blue color. So it is blue color. So it is blue cylinder. It is our nitrous oxide is blue. Now without oxygen we will die and cause necrosis. So oxygen white, alive. Without oxygen black, necrosis. So remember black and white. So black body and white color. So that is the mnemonic to remember. So this was asked in the exam. White collar, black body, necrosis is the mnemonic. It is our oxygen. It is our oxygen in this case. So this is our oxygen. Are you clear, all of you? Okay. Now what about the air? So air is a mixture. That's why air contain what? It contain our black body with white and black shoulder. Okay. So air is mixture of the two. Okay. Now lastly, what is nitrous oxide will be? Again, it's a mixture. So it is blue body and white shoulder. Collar लिख दिया मैंने, shoulder. So white shoulder, here also white shoulder. So let's revise it. I want everyone to do it with me because 100% question is coming from this topic. Can we do it? Okay. So let's revise. Okay. First, what is 1-5? What is 1-5? What? Yeah, it's for NEET PG also. It's sufficient, more than sufficient. Okay. If you have time, you have full day to do anesthesia, most welcome. Do it. If you have 2 hours for anesthesia, do this. Do the PYQ, more than sufficient. Okay. So air. What is 2-5? 2-5. Very good. Very good. Everyone here. Very good. What is 2-5? 2-5. What is 2-5? Oxygen. Very good. What is 3-5? 3-5. 3-5. I'm just doing important subject. 3-5. So 3-5 is our nitrous oxide. N2O. N2. Okay. Okay. What is the color of nitrous oxide? Color. Very good. Let's see who give the answer first. Color. Very good. Dr. Krishna, Dr. Gaurav Desai, Dr. Mohammed, first to give the answer. Congratulations, blue. What is oxygen cylinder color? Oxygen color. Oxygen color. What is the color of oxygen cylinder? Color. Let's see who give the answer first. Very good, Dr. Arun Chand, Dr. Monica, Dr. Shalini, very good. It's black and white. Black and white. Like me, I am wearing a black t-shirt and my face is whiter than black. Okay, I'm not saying I'm white, but it's like, so it's like me. Remember, I am your oxygen. Black body, the black t-shirt, but white shoulder. Okay, white shoulder. Okay. And what about the air? It is, yes, some books say gray, some say black body with white and black shoulder. Okay, very good. Now, can you tell me what is 7? What is 7 number? 7. Very good. Dr. Yatin, vancomycin, Galgappo, very good. Niaz Raz, very good. Very good. What is 7? Antonox. What is Antonox color? What is Antonox color? Anyone? What is Antonox color? Yeah. Anyone? Yes. Blue and white. blue body, white collars, okay, white shoulder or collar, white shoulder. Very good. Finally, what is 3 6s on a cycle? 3 6, 3 6, 3 6. What is 3 6? 3 6, 3 6. 3 6 is cyclopropane. 3 6 is cyclopropane. Very good. So 3 6 cyclopropane is 3 6 cyclopropane. Very good. What is the color? Color. Tell me the color. Very good. Orange candy. And finally, what is 1 6 and 2 6? 1 6 2 6. Finally, give the answer. 1 6 2 6. 1 6 2 6. 1 6 2 6. Yes, it is CO2 gray cylinder. Very, very good. Congratulations to all of you. One question sure. So one question done in NEET PG and FMG both the exam. So that means you are getting one right. Let's do the remaining other topics. So this is the case. So 1 5 is air, 2 5 is oxygen, 3 5 is nitrous oxide, which is blue. 1 6 2 6 are CO2, more than 7%, less than 7%, and it is cyclopropane is orange color. Antonox is 50% oxygen, 50% nitrous oxide. Helium has no pin, it is brown. So helium is no pin, it is brown color, and heliox again 2 4 and ethylene 1 3. So extra point, it is 2 4 and it is 1 3. 2 4 is brown. Can you see brown color? This is our yes ethylene. Okay, so let's see. This is oxygen, black body, white shoulder. This is our nitrous oxide, full. This is cyclopropane, carbon dioxide, gray. This is our what? This is our air. This is our air. And this is this is air with gray body and black and white shoulder. So this is the air which is here. Okay, air. And this is oxygen, helium. That is our heliox mixture. Heliox. Okay, let's move on. Inhalational anesthetics. Okay, now remember the concept of MAC. MAC is mukka marunga tere, mukka. If you mukka, punch someone, MAC. MAC is the minimum concentration of the agent which cause 50% of the subject to be losing the consciousness. So if 50% of the people is losing their movement, that is anesthesia, it is called as MAC. Okay, now lower the MAC, more the potency. Why? Our agent require 1% to cause the anesthesia, other require 10. Who's more potent? 1%. So remember, MAC is the inverse of potency. So remember, higher the MAC, lower the potency. So for the case, methoxyfluorine is the most potent. So the most potent methoxyfluorine. Then we have the mnemonic HISD, which I'll tell later. Least potent is nitrous oxide 104. So one summary: most potent methoxyfluorine, but not used. It is nephrotoxic, and the least potent is our nitrous oxide. Now let's discuss the nitrous oxide. It is a very good analgesic. Dentists use it. So used by dentists. So हंसते हंसते दांत निकाल देता है dentist. क्या करता है ऐसे ha and he take. You don't even feel. So that's why dentists use it, but very poor GA. It doesn't cause loss of consciousness. It has maximum MAC, therefore least potency. That is why it failed to cause anesthesia by itself. That is why it doesn't cause GA by giving alone, but it does help the other gas. So that's why simple mnemonic: those who cannot fulfill their dream, they help other people realize their dream. जिनके खुद के सपने पूरे नहीं होते, दूसरों के सपने पूरे करते हैं. Those who cannot get a friendship relationship, they help the others. Those who cannot book a room for themselves, they book for other people, like agents, dallas. Okay, so that's why it is a agent. It is helping the second agent. So that's why it helped the second gas. Example, sevoflurane. Example, sevoflurane. Okay, example, sevo. So that's why we give nitrous oxide with sevoflurane or halothane, most likely sevoflurane, and it will potentiate the effect of the sevoflurane. This is called a second gas effect. So who's the first gas? Nitrous oxide is the first gas. So what is the first gas? First gas. Who is the second gas? Sevo or other agent. But problem is, when you give these two gas together, they displace the oxygen. and that cause diffusional hypoxia. Or third gas is oxygen, and that's why it is also called as Fink's effect. So remember, first gas nitrous oxide, second gas given with it is, second gas could be CO, halothane or other gases, and what is the end result? Can cause diffusional hypoxia or Fink effect. So clear? So remember, this is very important. Okay, kya baat hai? Thank you very much, Dr. Gokul. Yeah, it'll be available for any time, you can watch it, available till the exam. Okay, now next question, contain oxygen, so it can cause fire. Why? Because oxygen is there in the N2O, so that is why it is contraindicated in laser surgery. Which thing? The Antonox. Okay, which thing? Antonox. Antonox. So Antonox contain oxygen, that is why it is contraindicated in cases of our laser surgery. Okay, so what is the second thing? N2O increase pressure of air filled cavity, that's why we avoid in pneumothorax, small bowel obstruction, middle ear, anywhere there's a air filled surgery. So remember the mnemonic, nitrous oxide is avoided or contraindicated in air filled chamber or pneumothorax or pneumoperitoneum, anything. Okay, next question, very good. Now come BGS, bhaga re bhaga, BGS. So it is blood gas solubility, it is the opposite of speed. So lower the BGS, more the speed. Why? If a gas has high solubility, large amount of agent will be dissolved in the blood, only then it will be able to reach the brain. But if a gas has low solubility, it will dissolve minimum in the blood and most will reach the brain and causing the effect very fast. So that's why lower the BGS, faster the speed of induction and also recovery, and higher BGS, slow. So let's revise the summary. What is power? Potency is? Potency is given by Mach, inverse of Mach. Who's most potent? Methoxy. Least potent is nitrous oxide. That's why it is used as second gas effect and cause third gas, oxygen lack, that is diffusional hypoxia. BGS means what? It's speed, reverse of the speed, and it is very important, must be, yes, giving the speed. So speed is BGS. Let me write the speed. So BGS is the reverse of speed and Mach is the reverse of potency. Okay, reverse of potency. Okay, let's see. Xenon has the least BGS and that's why the fastest inhalational agent. So who's the fastest? Xenon. So remember, X is very fast. X is very fast. So remember, X cut you from your life and they run away very fast. So X is very fast. Who's very fast? X. It's a pure inert noble gas. It's a noble gas. Remember helium, all these gases. So it's a, yes, inert gas, odorless, non-explosive, no fire risk, very safe. It is closest to the ideal anesthetic agent. Why? Very fast speed, recovery is very fast, analgesic, also neurocardiac. The best, best. But only problem, X is expensive. So mnemonic, X is expensive. Remember, X is expensive. Why? Because they gave you lots of things. Okay, one of them is experience. So remember, only Ambani can afford the Xenon. So that's why remember, it is not used much because very costly and it has low potency. Mach is 70. So that is why X is expensive. What is expensive? X is expensive. So mnemonic is, who's expensive? X is expensive. But respect your X. Why one should respect the X? Because X gave you experience. Clear? They always be thankful. They taught you so many things. Okay. And remember, when you say bad about anyone's X, you are also someone's X. So be wise. Okay. So halogenated, IA. Okay. Halogenated. Okay. Now they release fluoride. And this is mimicking the effect of GABA. Why? GABA acts through chloride and fluoride is similar to chloride. So that's why again they are GABA acting mechanism. They inhibit the brain via GABA mechanism, open chloride channel and cause hyperpolarization and shut down the neuron. So that is the mechanism. Now they end with fluorine except halothane. Name itself contain halo. Halogen are what? The single like valency compounds like what? Iodide, fluoride, chloride, bromide. Remember chemistry, all iodides are called as, this substance are called as halogens. Okay. Now second, methoxyfluorine is the most potent but not used Because it causes vasopressin resistance, high output renal failure. Why? Maximum fluoride release. It causes maximum fluoride. So that's why ignore it and only focus on the 4. What are the 4? HISD. HISD. What is HISD? H for halothane. H for halothane. H for halothane. I for iso. S for SIVO. And D for DES. D for desflurane. So isoflurane, SIVO, DES. So remember mnemonic, his dream. So mnemonic is his dream, his desire. Uska kuch bhi yaad kar lo. His D. D for anything. So his D. So what is the potency? His D is the potency. H is most potent, then I, then S, then D. D is least potent. Reverse it for speed. Who's the fastest? So it is the fastest. D is fastest, then I, then S. So remember, speed wise, dish is the mnemonic, dish, and potency wise, his D. His D potent है, तो याद करना his D potent है. तो उसका D बहुत, D मतलब उसका dream बहुत potent dream है, बहुत powerful dream है. So the dream is very potent dream. So let's revise it. So let me ask you, okay, who is the most potent agent? Most potent. Most potent. Most potent. Tell me, most potent. It is methoxy. It is methoxy, bhai. Use, not use. Nah, not use because it is nephrotoxic. Very good. So what are the use potent? It is HISD. H, halothane is most. So halothane is the most potent. Okay. Who is least potent? Least potent. Least potent. Very good, Pratyusha. Very good. Who's least potent? Anyone? Which one? Which agent is least potent? Anyone? Least potent. Least. Okay. Least potent should be our nitrous oxide. But if they are asking out of this, then the mnemonic is D is the answer. Desflurane is the answer. So if they give nitrous oxide, that is the answer. If this is not giving nitrous oxide, D is least potent out of these 4. So what are the least? D is the least. Okay, D is the least. Very, very good. Okay. Then what are the fastest gas? Fastest. If they ask out of these 4, HISD, his dream, then it is D is the fastest. But if they ask even faster, xenon. Xenon is even more fast. Xenon is very fast. Okay. Xenon. Why xenon is not used much? Why? Why xenon is not used much? Anyone? What the reason we don't use xenon much? Reason. Very good. Expensive. Xenon is very expensive. Very, very good. What is contraindication of nitrous oxide? What is contraindication of nitrous oxide? That is how we learn. I explain you the topic, then I ask you question and you see this PDF 2-3 times. Done. You are perfect. So what are the contraindication? Yes, air-filled spaces. Air-filled cavity, increase pressure. So don't use in air-filled cavity. So don't use in air-filled cavity. Avoid it. Very, very good. Very, very good. Okay. Yes. Catch fire is N2O. No, it's a nitrous oxide. No, it's Antonox. Antonox is the one with fire risk. So don't get confused. Antonox is the fire. Arey, I will give you, bhai. Important list I have already submitted. I already forward. I'll again forward you after the class. Don't worry. Okay. I'll share a PDF folder in which I'll add the most important topic also. Clear? Okay. Let's go back and continue. Halothane. Remember halo. H for heart. H for, remember mnemonic, H for halo, H for heart, H for hepato. So it is heart cause arrhythmia. And what is the color of heart? Red. Liver color? Red. So remember red color. So heart and hepato is the red color. So it is hepatotoxic and it is also stored in amber because the light, UV light, can cause the, yes, halothane to break down. So that's why stored in dark or amber colored bottle. Heart is caused arrhythmia because of fluoride release, which causes again arrhythmia affecting the membrane potential, then hepatotoxic, liver damage, lung, it causes bronchodilation, so can be useful in asthma. Okay, so that is why it's second preferred agent in children after sevoflurane. After sevoflurane, and it is sweet smelling. Okay, halothane is also sweet smelling, color is red. Now come our isoflurane. It's very irritable, so not used in children and asthmatic. Clear? Agent of choice in cardiac and neuro. So cardiac, neuro, iso slightly superior to other agents, so that's why it's very potent also. Why? Reason it's potent also, and it is, yes, good in this case. Desflurane, des is dirty, so that's why it's very fast. It's very fast, but problem is it is dirty smell, so it causes airway irritation, which cause dyspnea. So what cause dyspnea? Des cause dyspnea. And remember, what is the color? What is the color of this? Anyone? What is the color of desflurane? Anyone? Des. Color. Yes, it is blue. It is blue. Okay. Iso is purple. It is purple. Okay. Blue. Very good. Purple and this blue. Okay. Des. Okay. So remember dyspnea. So when you don't have oxygen, you get blue. Cyanosis. So remember, it causes cyanosis dyspnea. Cyanosis is the mnemonic. So it causes cyanosis and blue. Cyanosis and blue. Okay. Yes. Okay. Now finally, sevoflurane. Sevo, sweet, and children are very sweet, so use in children. And it is also agent of choice for daycare surgery out of IAs, inhalational agent. So out of IAs, what are the preferred? Sevo is preferred. Okay. And avoiding renal surgery. Sevo is also used for asthmatic. Again, it can cause bronchodilation, cardiac surgery, neurosurgery, liver surgery. Okay. Except renal, it is used in all, especially children. Now, daycare means 24 hours, less than 24 hours. That means you admit the patient, discharge the patient within 24 hours. Okay. What is the mnemonic? Dismap. What is this map? DRIA. Map is IV agents. What is this? It is desflurane, iso, sevo. Map is midazolam, alfentanil, and P is propofol. Propofol is overall best. Who's the best? Propofol. And in gases, the best is our sevoflurane. So out of IA, who's the best? It is sevoflurane. And if they say overall, it is your propofol best. So overall, who's the best? Propofol is the best. Okay. See, again for cardio, again I'm telling you, sevo is best for neuro, ऐसे याद कर लो, and cardio we can use sevo. Okay, clear? Cardio, children, daycare, sevo. Okay. Neuro, iso. Okay. So I'll just highlight it for you because this as per the notes of Dr. Swati. So I saw her notes and I used them to create this revision file. Okay. Yes. So iso and neuro. Okay. Chal. Next question. Okay. Yeah, Dr. Vishnu, I'll ask her to take session. She is very busy in her internship. So I'll request if possible to take some topics. Okay. IV agents. Now we start IV agent. First is thiopentone. Yeah, it's available 24/7. You can watch last session also, this session also. We don't delete the sessions. We don't delete. Okay. Yeah, I'll ask Dr. Yes, Vishnu to take some important topics. So IV agents. So they are thiopentone, which is a barbiturate. Again, GABA mimetic. Okay. And remember, Barbie फाड़ देती है. Barbie फाड़ देगी. Porphyria. So barbiturates are always contraindicated in porphyria. Okay. So they can precipitate this seizures in porphyria. Also hypotension, heart block. So remember, Barbie फाड़ देगी. अरे हम नहीं करते भाई. We give free. We don't charge any money and we don't delete. Okay. We don't ask them to go to our app and watch. It is in YouTube. Everyone to watch. Only thing is people don't want to watch us more. They want to watch famous platform more because they trust. वही बात है ना. छोटी दुकान पे कौन आता है कि नहीं? When there is a very big 5-star restaurant and there is some small छोले कुलचे वाला. अब I am not like वो चाय की टपरी डॉली चाय वाला. He is famous despite टपरी. ठीक है. So we are like even below Dolly Chaiwala, no one come, no one watch us, so we are not getting that much, you know, leverage. Clear? So we are like a maybe good thing but not famous. So I can say that maybe one day we'll become famous, we'll have more people watching our session, and yes, give us enough, because content wise is not inferior. You can compare to any other revision material in the market. I can say that 27 pages are more than, you know, like all 5 subjects. I've seen very famous revision or chanting sessions in which hardly 10-12 pages are there for anesthesia. I am having 27 pages covering everything, INICT questions also. So I don't know. So what is the case? Okay, so I hope you all pass, get good ranks in NEET PG. Okay, and then yes, you people is going to support us. That's the only thing. If not, again, what I'll do, I'll just leave this field, I'll do something else. Okay, but again, it's up to you. I continue, I teach you people, help you, it's up to you. If you don't want, I'll stop. That's as simple as that. I'll do some other work. Okay. Okay, now what is the color? So remember, it is yellow powder, clear, which is having 6% anhydrous sodium carbonate. Now this highly alkaline, so it should not be reconstituted in the acidic solution like Ringer lactate. There's a precaution. Dose is 3 to 5 mg per kg, and it causes loss of the reflex, especially eyelash reflex. That is, the eyelids will not be moving. That is corneal reflex simply. Smell is garlic. So remember, barbiturate, this smell is garlic. It is the agent of choice for neurosurgery. So thiopenton is also induction agent. Is also an induction agent. And induction agent. It is very fast. Okay. So within 11 to 13 seconds, it causes loss of consciousness. 11 to 13 seconds cause LOC, loss of consciousness. Okay. Contraindication, I told you, it is our porphyria. Now propofol. Remember, propofol is diisopropyl phenyl. It is the one which is also used in what? Yes, our sanitizer. So if you ever get this question and you forget, look at the bottle of sanitizer. Sanitizer is also isopropyl alcohol. So it's isopropyl phenol or alcohol. So isopropyl alcohol. And it contain what? It contain, yes, EGS. So it contain EGS. What is EGS? EGS. It contain egg, glycerol, and acid soya bean oil. Soya bean, EGS. Okay. It is basically, yes, highly lipid soluble, which cause a rapid onset of action, render the person within 30 seconds. And what is taking 11 to 13 seconds? It is thiopenton. So what is faster agent? Thiopenton. Then it contain what? What is the color? Milky white. So milky white was asked in the exam. Milky white solution is your propofol. It is the most common reduction agent, agent of choice with malignant hyperthermia. Remember, doesn't cause the shivering and increased body temperature like malignant hyperthermia. Number 2, open eye injury, neurosurgery, hepatic disease failure, office-based procedure like daycare surgery, rigid bronchoscopy, etc. All we use our this propofol. Can be used in liver kidney disease patient also. Why? Because it is not going to be, yes, affecting this. So that's why can be used in these patients also. Okay, patients. So which patients? Yes, our liver and kidney disease. Also for ICU sedation also. Only side effect is pain on the site of injection. Pain on the injection site. Hallucinations can be there. Sexual fantasy or office turnus. That is, it is curvature of the back due to contraction of extensor muscles. So extensor spasm. Extensor muscle spasm. Also seen in tetanus. So like this, the person becomes, this is called as opisthotonus. Green color urine after prolonged infusion is the one more side effect. But most common is our, which thing? Yes, most common they ask you is pain at the site of injection. Okay. Now ketamine. Mnemonic is cut the mind. Ketamine, cut the mind. So it causes cutting of the mind. Dissociative anesthesia. MCQ. So what causes dissociative anesthesia? It is ketamine. Cut the mind. It is the only agents along with the xenon which causes NMDA antagonism. Xenon also. All others are GABA agents. So this is also GABA agent. So again, it is also GABA agents. GABA. So act through GABA mechanism. Now, ketamine is a complete anesthetic agent. It induces analgesia, amnesia, unconsciousness, everything. Okay, but there is person is awakened, but no pain is there. So patient appear conscious, but doesn't respond to sensory stimulation. That's why called as your dissociative anesthesia. So pain is not there. Person is, yes, not having any memory, any this. But problem is what? Lead to post-op hallucination. So it causes post-operation hallucination, is a very common side effect. Plus it increases sympathetic activity and all the pressure, BP, intraocular pressure, intracranial pressure. That's why avoided in neurosurgeries, also hypertensive or glaucoma patient. Don't do them where there's a high pressure. Increase muscle tone and also reflexes might be present. So that means reflexes are not completely lost. That's one problem. So muscle tone, reflexes are not lost, might be there or even increased. That's one more problem with them. That's why they are used in unstable cardiovascular patient suffering from hypovolemia. That is low BP. Unstable means low BP. Okay, so low BP. Then we can use our ketamine. Okay, we can use ketamine. Also cardiovascular depression in sepsis. Myocardial depression occur because of the gram-negative endotoxin. So that is why we can use ketamine. Also, yes, in the patient with reactive airway disease, it causes bronchodilation. So what other agent cause bronchodilation? Yes, it is also caused by halothane and sevoflurane. Okay. Now come the last agent, that is etomidate. Etomidate is a opioid. It is a opioid. So cardiostable. So that's why it's cardiostable. Others were not very important, but this is a very important property. Cardiostable. Which is cardiostable? It is etomidate, and that's why agent of choice for cardiac aneurysm, like angioplasty, like all the angioplasties. Okay, PCI. Okay, stenting. Then aneurysm clipping. We use what? We will use our etomidate. Okay. It is painful on injection, can cause muscle tremors and high rate of nausea, vomiting, and also cause respiratory depression. Okay, also respiratory depression. That's again the side effect. So these are all the side effects. Now malignant hyperthermia, very important. I will take, okay, don't worry doctor, all in one. Next question. Yeah, most cardiostable. So remember, cardiac surgery, what should be used? Yes, our opioid, etomidate. What is for our neurosurgery, etc.? Yes, we were using the thiopentone for neuro. Okay, what is used in unstable patient with low BP? Ketamine, and oral the preferred one. Propofol is oral the preferred one. Now malignant hyperthermia. It's a rare genetic autosomal dominant hypermetabolic muscle disease which is triggered by drugs. So autosomal dominant is also called as pharmacogenetic disease. So also called as pharmacogenetic. Why? Because it is triggered by pharmacological agent. Okay. Now, what can trigger? Remember, mnemonic is fluorines, sucks, ligno, not lingo, it's ligno. So fluorine sucks. So remember, mnemonic is fluorine sucks. So which fluorine? All the halogenated compound like ether, halothane, all fluorines. So fluorines or halogenated one. Then non-depolarizing. It should be depolarizing. It's by mistake. It should be depolarizing. So depolarizing muscle relaxant like succinylcholine, succinylcholine, SCH, and lignocaine, ligno. So remember, mnemonic fluorine sucks ligno. So all the fluorines, CIVO, ISO, DES, methoxy, halothane, all the fluorines, but not N2O, not our, yes, propofol, they are not causing. Okay. So let's revise it. 100%. Yes, जब कुछ नहीं आता, go for propofol. So tell me, which one cause malignant hyperthermia? Which agents? Tell me. Which agents cause malignant hyperthermia? 100% exam question. I am feeling 23rd June, NEET PG, MCQ number 42, block A. This question will be there. Okay. So be ready. 40 तो है नहीं उसमें 40. Okay, 100% is going to be there. Let's see. Yes, so mnemonic is fluorines, that is halogenated compound, plus SCH plus ligno. So ligno sucks. So remember, mnemonic ligno sucks, fluorine sucks, full suck. So क्या है? Full sucks ligno, full sucks ligno, full sucks ligno, full sucks ligno, full sucks. Okay, so full suck ligno. Okay, chalo. Now comes the question. So pathophysio, not propofol, not N2O, not xenon. Okay, not ketamine, they are safe. Pathophysio. So basically there's a gene called as ryanodine receptor gene 1 on chromosome number 19. It is for calcium release. So now there is increased calcium causing increased sustained contraction. That's why patients start shivering on the OT table, which increase the heat, and this causes increase in the end-tidal carbon dioxide, which I'll discuss later. It is end-tidal carbon dioxide more than 80 to 100. That's the hallmark. This is the question they ask you. End-tidal CO2 more than 80, patient shivering, increased body temperature, all are indicative of malignant hyperthermia. What is the immediate cause of death? Arrhythmia, because of potassium release. What is the iron for death? It is potassium release from the this, and myoglobinuria causes kidney failure. So what is the treatment of choice? Stop the agent, and give dantrolene plus supportive care. Supportive treatment. Okay, dose is 2.5 mg per kg IV every 5 minutes till the episode is terminated. Okay, now we'll discuss neuromuscular blocking agent. They relax the muscle. Why? Because at the neuromuscular junction, what happens? ACH bind nicotinic receptor, open sodium channel, depolarize the muscle, and contract. So very simple physiology. ACH bind what? ACH bind nicotinic receptor at neuromuscular junction, open sodium channel, depolarize the muscle, and causes the contraction. Now, how can you prevent the contraction? Two methods. Like if a child is about to cry, how can you stop him from crying? That is, how can you make a muscle from contraction and relax it? First, Indian style. Let the child cry. Okay, he's crying. Okay, you want PlayStation? Okay, I don't give you. What do you want to do? Cry. So now the child is crying. Then he stop. That is depolarizing. So depolarizing mimic the action of ACH. They bind receptor, open sodium, depolarize, briefly contract, then relax. That's why they are mimicking ACH. But then they cause this muscle to relax. After brief contraction, muscle relaxes. Are you clear? Like brief contraction, then muscle relax. Are you clear? And we can use it for checking by using the thumb muscles. Okay, for checking whether the muscle is relaxed or not. Okay. Other method. Don't let the child cry. Like child is about to cry, PlayStation. So that's why non-depolarizing. Don't let the ACH bind. So what they do? Don't let ACH bind. So they are competitive inhibitors. So what they do? They are competitive inhibitor. Don't let ACH bind. So what they do? Don't let ACH bind. So that's why no depolarization. No depolarization. What they are? Competitive inhibitors. That's why they are reversible. So that's why they can be reversible by cholinesterase inhibitor like neostigmine, pyridostigmine. Now succinylcholine, SCH. Obviously succinylcholine cannot be reversed. It cannot be reversed. Why it cannot be reversed? Because it already is depolarizing, so it can't be reversed. So there is no antidote. It's very short acting and it causes train of 4 is present. Train of 4. What is train of 4? That is, it should be absent, not present, absent. So train of 4 is absent here. Train of 4 is present. I'll show it later. But train of 4, muscle pain and also malignant hyperthermia risk. Because muscle is contracting, so malignant hyperthermia. When the patient regain consciousness, he can feel pain. Malignant hyperthermia. Here, no MH risk. No muscle pain as absent. Should be absent. Muscle pain is absent. So there's no muscle pain, no contracture, no malignant hyperthermia. Here muscle contract, that's why hyperthermia can occur. Train of 4 is absent, short acting, no antidote. Okay. Now let's discuss first the non-depolarizing. So non-depolarizing are curiums and curoniums. So they are curium and curoniums. So curium and curonium. Remember, curium, curonium. Curium, curonium, curium, curonium. Are you clear? Very good, Dr. Pratyusha. Very, very, very good. Okay. Very good. Perfect. Perfect recall. Very happy. Now, first question. They are two types. They are benzyl isoquinolonium and they could be amino या ammonio steroids. Ammonio steroid. Now, first is remember the summary. Okay. First is I write the summary here. First, remember queen. The mnemonic is queen. Queens. Queens are curiums. Queens, queen, curiums. So queens are curium. Mnemonic is queen. Madam Curie queen थी ना, curium. Are curiums. And aminio या ammonio. It contains the word ammonio, neo. So it is curoniums. It is curoniums. So aminio, yeah, just write amino. No. So no. So it's curonium. So it's curonium, amino. Queens are curium. Queens are curium. Okay. Now remember, queen को हमेशा क्या होती है? Allergy. Queen has allergy. So what queen has? Queen has allergy. So what they do? Allergy. So queen has allergy. They cause histamine release. Histamine release and allergies occur. Cause anaphylactic shock. So what it can do? Histamine release. Histamine release, anaphylactic shock. Okay, but good thing, they are not requiring liver and kidney for metabolism, so they can be used in liver kidney disease. They don't cause this, but they are not useful in renal or liver disease. That's the simple summary. So if there is a risk of anaphylactic shock or low BP, etc., avoid the queen. Queen cause allergy. Allergy cause this. And if there is our renal or the liver disease, don't use the curonium. So curonium not used in liver kidney disease. Okay. Now what is the agent? So let's see. First question. Mivacurium. It is the only non-depolarizing which is metabolized by pseudocholine esterase. So remember, pseudo. That is why it doesn't need reversal by anticholine esterase agent. So that is why it is the agent of choice for day care. So the agent of choice for day care in terms of muscle relaxation, it is mivacurium. Okay, it is the shortest acting NMDR available for use. Technically, it is the shortest acting. Okay, otherwise rapacurium was the rapid acting but not used. Rapa was the fastest but not used. Rapa is fastest but not used. So that's why what is the clinically fastest? It is mivacurium. It again releases histamine. I told you allergy करती है murium curium. Now atracurium cis. Atracurium, remember atra khatra. So atra is half. It make itself atra katra half. So it decrease itself by non-specific hydrolysis and Hoffman elimination. That is non-enzymatic. That is no need of liver for excretion या metabolism. That means it can be used in what diseases? That is why can be used in our what diseases? That's why it is used in liver kidney disease. Okay, liver kidney disease. And remember atracurium, it creates something called as lodanosin. Lodanosin, लोडा है, ठीक है. So lodanosin toxicity. And remember लोडा कहते हैं दिमाग पे, तो दिमाग का बिल्कुल लसन कर देता है, क्या कहते हैं दिमाग का खराब. So लसन लीजन कर देगा, सीजर. So lodanosin is causing seizure in the brain. It causes seizure in the brain. Okay. And sister has less khatra. So sister doesn't have lodanosin. So minimum. So sister का lodanosin नहीं होता. किसमें? Sister में नहीं होता. याद कर लो, sister cis doesn't have the lodanosin. So that's why it's safe. Plus also less or no histamine release. So no risk of anaphylactic shock. So remember, queens, curiums cause histamine, allergic anaphylactic reaction. So they cause anaphylactic shock. Except which one? Cis atracurium. Okay, and it's also more potent. So what is best for liver kidney disease? Cis atracurium. Pancuronium. Okay, it is very long acting. It's a long acting one, okay, and it is used in patient with shock. So it is used in patient with shock. Reason, it doesn't cause anaphylactic shock, it rather increase sympathetic, but it is excreted by kidney, and that is why not used in kidney disease. What we use in kidney and the liver disease? Curiums, not curonium. Curoniums are not used. Done. Thank you, Dr. Gaurav. Yes. Okay. Now, V-curonium and rocuronium, just remember it's very fast. So for rapid sequence intubation, we prefer SCH. But in case we are not using SCH, we can use rocuronium. And that's the case. Okay. So what is the agent for day care anesthesia? It is rocuronium plus sugammadex, which is for reversal. Sugammadex is used for reversal of this. Okay. And what are the most cardiostable? Most cardiostable is vecuronium. Okay. Tuberculosis is the first. It is not used. You can skip it. Doxa is the longest acting. So the doxa is longest acting. So doxa is the longest acting. Now we see ASA grading. That is this American Society of Anesthesiologists. So let's see. A1. He is A1. कहते ना भाई मैं A1 हूँ बढ़िया फर्स्ट क्लास. कैसे हो? A1 फर्स्ट क्लास. 2 is थोड़ा बहुत कभी प्रॉब्लम होती है. 2 नंबर. So mild disease. 2 is mild. 3 is moderate disease, like example maybe having diabetes something. Okay. 4 is severe disease, threat, like he is having some unstable angina something. So it is severe disease, threat to life is there. 5 is moribund patient, he is not supposed to survive more than 24 hours. And 6 is dead patient, brain dead patient. 6 is ball is out of boundary, he is gone, he is almost gone, brain dead. Okay, so let's revise it. So what is ASA1? Anyone? ASA1 is normal. ASA1 is normal. ASA2 is mild. 3 is moderate disease. 4 is what? There is a yes, threat to life. Okay. What is 5? 5. Anyone? Let's see who give the answer. 5. 5 is our moribund. And what is 6? 6 is brain dead. Okay, brain dead. Very good. Okay. Now for the laryngeal grading, we can use the Cormack and Lehanes. Okay. Just remember 3, 4 are difficult. That's the important. Okay. 3, 4 are difficult. That's the only question to remember. 3, 4 are difficult airways. Okay. Now what is the intubation position? It is basically chin lift, head tilt, also called as barking dog position. So remember chin lift, head tilt. So remember it like this: CL, and what? And HT, head and tail. So remember head and tail. And what is CT? CT is basically chin lift in this particular case. So are you clear? So chin is lift. Clear? So are you clear now? So chin is lifted. Okay. Now one more thing is, what is the distance from the chin mentum to the top of the notch of thyroid cartilage when the head is fully extended? It is called as the thyromental distance or the Patil test. Okay. If the distance is long, it is easy intubation. If the less than 6, intubation is impossible or difficult. If 6 to 6.5, less than 6 is intubation is impossible. Call as what test? It is called the Patil test. Patil's test. Okay. Yeah. This is our atlanto-occipital joint extension. So we are doing a chin lift, head tilt. So it's basically used for this tilting. And remember, again, we are checking the grades. Okay. So I'll just skip this part. Main is the morning dog or sniffing position is the classical one. Okay. Just remember the grades. 35 above is grade 1, less than 35 grade 2. Then 12 to 21 is grade 4, and 12 is less than 12 is grade number 4. 3 is 12 to 21. Okay. Now airway evaluation. Remember, it is factor causing difficult bag and mask ventilation. Mnemonic is obese. What is obese? Obese is O for obese, obviously. what are the BMI, more than 30 BMI, then bearded person, इसलिए भाई शेव कर लो, वो कहते हैं ना नो बियर्ड नवंबर, और भी कुछ होता है, please shave it because shaving will prevent the mask from attach. Then no teeth, without teeth again it is difficult because of closure of the mouth. Okay, then history of snoring, that is obstructive sleep apnea history, and elderly में सब कुछ ही बेकार होता है, ठीक है. चलो, एयरवे इवेल्यूशन, मल्लम पट्टी. सो मल्लम पट्टी, रिमेंबर, वेरी वेरी इंपॉर्टेंट, 3-4 are difficult intubation. So just remember 3-4 are difficult intubation. 3-4, I'll go to it again. Okay, Dr. Golgapo, I'll go. Okay, 3-4 and large tongue are difficult intubation. This is the exam question. Are difficult intubation. Very very important topic, difficult intubation. So this is what intubation? Difficult intubation. Okay, now class 1, class 2, remember, very simple. If you can see the pillars, it is 1. So this pillars, if you can see, it is 1. So the pillars, this one. If pillars are not visible, it is 2. So remember, pillars are present, pillar is absent, pillar absent. So if pillars are not visible, it is our 2. Then if your fossils, the fossil area not visible, plus only base, tip is absent. So tip absent. So if tip of uvula absent, it is 3. Only hard palate, this HP, this is uvula U, uvula base. So if this is tip of uvula and the base, so if you see hard palate, nothing else, it is class 4. So let me show you and ask you, can you tell me the answer? Okay, if pillar is absent, what are the grade? Pillar absent, pillar absent, pillar, no pillar is seen, grade, no pillar, no pillar. Very good, medico-phily, grade 2. If there is pillar absent, if only base of uvula visible, base of uvula is visible, base of uvula, very good. And if only hard palate, HP, only hard palate, what are the grading? Only hard palate, very good, only hard palate, it is our 4. This is 3-4, very good. And if pillars are seen, it is 1. Pillar seen 1, no pillar 2. If no fossils and this yes, tip of uvula not seen, it is our 3. If only hard palate, it is 4. Very good, perfect. You are rocking and you will do well. See, we have done half in just 1 hour. We're just doing the remaining half and finish. Now remember, the factor causing difficult laryngoscopy and intubation mnemonic is lemon. So lemon, when life give you lemon, what do you do? Yes, make lemonade, okay, or sell it and put it in the ground, grow more lemons and sell them. Okay, you can do. So शुरू करते हैं. पहला L, look externally, any facial trauma, large incisor, beard, large tongue, or highly arched palate, high arched palate. Then E, evaluate the 3-3-2 rule. Okay, Mallam Patti score more than 3. Again 3-4 are difficult. O, obstruction, any epiglottitis, inflammation, abscess, trauma, and neck mobility is less, so you cannot do the head tilt chin lift maneuver. Okay, now this is our Boyle's apparatus. So which apparatus? Boyle's flowmeters. Then this is our rebreathing bag. Okay, carbon dioxide absorber, soda lime. Okay, because carbon dioxide produced by respiration can cause high CO2 narcosis, so need to remove the CO2 from the circuit, and that is done by soda lime, which make it into carbonates. Okay, and this is the oxygen flush button. Now let's continue. These are cylinders. Okay, you can see, and these are connected, and the front side show the readings. This is a gauge. So back side is cylinder, back side is cylinders. Okay, now anesthesia monitor. So what do you check? So first we check ECG, because arrhythmia are very serious, or shock or cardiac arrest. So ECG. Then ET CO2 and tidal carbon dioxide. It tells you about the respiration, intubation, etc. And also pulse oximetry, that is giving you the saturation of the oxygen. It is all check. Okay, plus what give you the SpO2? It is pulse oximetry. Less than 94% indicates some problem in oxygen supply to the body. Okay, then we also check the blood pressure, because shock or hypertensive crisis can be measured. So BP should be checked. Thank you Dr. Vijay. No, video is coming good. Okay. Okay. Chalo. Sorry. Okay, I'll show the thing again. Okay, so Boyle's apparatus I will show once again. Okay, so in Boyle's apparatus, this is the vaporizer where you put the gas canisters like the agents IA. So IA, inhalation agent, are put here as a canister. Then this is the flow meter which give you the rate of the flow of the supply to the patient. This give you the oxygen flow meter. So we are connecting gases behind. So this is the gases at the back side. These are gases. So gas cylinders. Okay, remember oxygen cylinder or the air cylinder or the nitrous oxide cylinder. These are the cylinders. Then this is the soda lime for absorption of carbon dioxide, which is there in the circuit. So that's the main question they will ask you. Okay, yeah. Now it's okay. Yeah. What is the cylinder with black and white? What the cylinder is? Black body. Anyone? Yeah, gases cylinder are at the back side. Can you tell me what is this black cylinder with this top? Anyone? Or this cylinder? Yes, oxygen. So this will be oxygen, and that is how do you connect. Okay. So what do you monitor in anesthesia? ECG, E2, ETCO2, pulse oximetry. Also, pulse oximeter is non-invasive, okay, method for measuring the saturation. And finally, Goodell's airway. This is a Goodell's airway. Okay, it is basically to keep the airway open if there is a risk of what? Airway obstruction. Okay. Then laryngoscope. Okay, it is basically to visualize the glottis. This is the light source, handle, curved blade. This is the blade. This is the light source. This is a small light bulb, and this is the handle. You know this. Okay, blade. Then Macintosh. Okay, so again Macintosh are the curved blades. Smallest is for children, and obviously largest one is for adults with long necks to reach. Okay. Then Millers are straight blades, mainly used for children. So children have a shorter and straighter airway, so that's why we use Millers. So Millers in the adults. Children we can use Macintosh. Also infants is again very straight tube called as Oxford. So Oxford is infant, children is our Miller, and for adults we use the long curved Macintosh. Now laryngoscope or bronchoscope, again they are used for difficult intubation or failed. We use the flexible ones. What do you use? Flexible laryngoscopes. Okay. This is Bullard. Okay, it is anatomically shaped, so it's the best one to go inside. And yes, rigid fibroscope. Okay. Let's discuss endotracheal tube. It is basically for airway access. So it's the definitive airway access. So definitive airway. Has cuff to prevent aspiration. To prevent aspiration. So it has cuff. What do cuff do? Cuff will prevent our aspiration. Okay. Hello Akshay. Congratulations for passing. Yeah. Flexible is used for in case of difficult airway. Very good. Okay. Now this is, I'll discuss in detail later. Okay. Also it contains the Murphy eye. Is the extra opening. In case there's a problem in the main opening, the Murphy eye can maintain the respiration. This is a cuff. Okay. Next question. Yes. This is laryngeal mask. It look like ear. So what look like the ear? Ear shape is laryngeal mask look like the ear. So you can say it is also called as brain's mask, and it is placed blindly in oropharynx. That's why first is it is easy, but it is not a definitive airway. There's the risk of aspiration. It can leak. So that's why it can leak, because it's not placed properly, and it is easy but difficult in terms of aspiration. So what is having high risk? High risk of aspiration leakage is LMA. So LMA, risk of aspiration is there. Okay. Okay. We can use capnography for correct placement. X-ray can be done, but mostly they are using capnography. Okay, this is Murphy eye. This is here Murphy eye. Okay, and this is a secure airway, prevent aspiration. Okay, if aspiration occur, we can use which maneuver? Yes, we can use the Salix maneuver. So in aspiration, I'll write here. If aspiration, we can use Salix maneuver. I'll write here. If aspiration risk is there, use Salix maneuver. What is Salix maneuver? We press the cricoid and collapse the esophagus. So the content of the stomach cannot come through the esophagus, and that is called as Salix maneuver. So we put pressure on the cricoid cartilage. So press cricoid cartilage. And collapse esophagus. That is called as Salix maneuver. Okay. Now next question. Okay. This is the flexible one. Okay. Flexible LMA. Now double lumen. If they are asking double lumen, remember double lumen is done to separate the lungs. So now one will stay in the bronchi, other will go for supplying one of the lungs. So that is why you are able to separate the lung. So that is why it has two lumen, pharyngeal lumen and tracheoesophageal lumen. Okay, so that's why it is used for lung surgery and provides single lung ventilation, like bullectomy, pneumectomy. Example, pneumectomy. So we want to remove the lung and we are using a normal endotracheal tube. What is the problem? Both the lungs are getting the air. How will you remove one lung? It can cause leakage and air to come out. That's why we need to separate the lung, and that's why this is done through single lung ventilation achieved by double lumen. So if there are double lumen, two sides, this is your use for what? Lung surgery. So lung surgery use our double lumen called as Comey tube. Okay. This is the cuffed endotracheal tube. Okay. Again, it is basically, yes, cuffed is better than uncuffed one. Obviously, prevent the aspiration that we have discussed already. Now we have second generation ones also. Okay, this I am skipping. Okay, because that is not asked much. Okay, so I'm just skipping. Okay, let's come to the monitors in the general anesthesia. Okay, so first question is what we check: ECG for arrhythmia. Thank you, Dr. Keshav, Priyan. Best of luck for your future. Get a very good seat and do well in your life from entire team. Yes. Now arrhythmia or arrest. Again, BP for shock, oximetry for hypoxia. Capnography, I'll discuss multiple use. Okay, like intubation, ventilation. So correct intubation, ventilation is okay. Also malignant hyperthermia. MH. Temperature, very important, again for MH, or sometime patient might go in hypothermia, so MH. Now capnography. So capnography looks like almost like a square boxes. So it looks square. It is basically CO2 level rise, then plateau, then fall during inspiration and expiration. So AB is baseline, base. Then there's a upstroke, that is BC, is expiratory. In expiration, CO2 increase. Then there's a plateau in which CO2 is continuously coming out around 40-45. Then as inspiration occur, it is going to decrease, and that is decrease in inspiration. So decrease PCO2. So decrease CO2, and in expiration increase CO2. So that is the curve. So it is flat, rise, fall. So that is your, okay, so rise in expiration, fall in inspiration. So this is your endotracheal this. Now first, if there's a spasm, you get a shark fin pattern. So shark fin. So if you see shark fin like this is your obstruction or asthma spasm. Okay. Then if there is hypoventilation, obviously CO2 will accumulate because you're breathing less. So need to, yes, this. Okay. Also it can increase in case of also MH, malignant hyperthermia. Okay. So malignant hyperthermia, or it is hypoventilation. Okay. So need to increase the ventilation. So if hypoventilation, treatment is increase flow rate. So increase the flow rate. Okay. Decreasing EtCO2, hyperventilation. Okay. It causes CO2 washout. Okay. Also fall in temperature, decrease metabolism. Hypothyroid patients, or in case of, yes, our fall in the body's temperature. Okay. So that is causing our, yes, decrease CO2. Rebreathing. Rebreathing is basically if there is inadequate inspiratory flow or rebreathing, it causes the CO2 level to rise. Okay. Maybe faulty expiratory valve allow the CO2 leak in. So CO2 leakage is there. Okay. Curare cleft. So when you do a mechanical ventilation, you can see a dip in the plateau phase. This is called as curare cleft. Okay. Curare cleft. Okay. Cardiac arrest, you will see absent cardiac output, blood flow. So CO2 will decrease because the body is not doing the, yes, blood supply. So CO2 cannot enter the blood. So that is why decrease in CO2 because of stoppage of the flow and exchange. Okay. And return of the successful. So as there is an increased cardiac output, it will increase. That is called as a return of spontaneous circulation. So let's revise it. First question, what is this pattern? What is this pattern? Anyone? What is this pattern? Yeah, this pattern. Anyone? This pattern. Shark fin. Very good. Seen in bronchospasm. Very good. What is this pattern? This one. This one. This one. It is curare cleft. So it is our curare cleft is there. So curare cleft is there. Very good. What is this one? AT. What is this one? AT. Yes, it is malignant hyperthermia. Very, very good. Okay. Very, very good. Okay. Okay. Let's see types of circuits. Now there are three types of circuits: open, close, and semi circuits. Open, close, semi. So three types. Open is very simple. It will just put, like Indian movie, how they put chloroform. They will put chloroform in a this cloth and put like this. This is called as open system. Put the chloroform and put in the mouth and the person become unconscious. Called as what? Called as the open circuit. Okay. What is the problem? It causes pollution. So it causes the gas to leak in the OT and can cause, yes, problem to the OT people. So that's why it causes pollution, not used. That's why it's not used, and it cannot be recycled. So the gas is lost. So we have to give more. So need to give more and more agent. So that's why not used. It is not used. Not used at all. Okay, clear? So Indian here. So as kids, this van, I'll just show you. So when we were kid, this van is a symbol of danger. So if you see this van standing, okay, what is this van used for in Indian movies? It is used for kidnapping. Okay, so this is the van for kidnapping. How do they kidnap people? Yes, this, there'll be someone, beta chocolate khayega, chocolate put, and they, so again that is the case. Okay, next continue. Closed circuit. In closed circuit is called as non-rebreathing circuit. In this case, there is the recycling of the expired gas. That is why it conserves heat, moisture, and the agent remain in the system. So agent will not be lost. It will remain in the system. Okay. First, it consists of carbon dioxide absorber, soda lime. So soda lime basically will absorb the carbon dioxide and prevent the excessive CO2 in this case. Now remember, fresh look pink. Fresh gulabi hogi, fresh is pink, and used is white. तो याद करना, अगर सफेद हो गया मतलब ये यूज हो गया, we have to replace it. Okay, replace. And what it contain? It contain our calcium and sodium hydroxide. hydroxide. Okay, OH. Okay, so done. Let's continue. So this is the circuit. It is the inspiratory limb where the patient get the air, then Y piece connect to the patient's mouth, or the intubation put in the endotracheal tube, and this is the expiratory limb through which the patient expire out, and this contain the expiratory valve, and now the reservoir bag is there, and this the ventilator which is giving the air in and out, and this is CO2 absorber soda line. Okay, this is a fresh gas inlet where you are putting the fresh gas, oxygen, etc. Okay, Mapleson circuit. Remember, Mapleson are 6 circuits, so they are semi-closed, 6 types. 6 types. So let's revise in my style. A, B, C, D, E, F. E, F sound like infant. E, F is infant. So use in children. E, F, infant, children. So in children, what we use? E and F. Children, E and F. Children, E and F. What are the two? They are Mapleson and Jackson-Rees. Okay, ISTPs. Okay, so IRTPs and Jackson-Rees. Okay, so what are they? Jackson-Rees. And IRTPs. ISTPs. Okay, that is used for our children for spontaneous and controlled ventilation. Now remember, AD first, BC. BC should not be done. So BC is banned. BC. So BC not used. A is basically, A is alone. A for alone. D is dependent. Now what do you mean? Alone means the patient is doing spontaneous breathing. Spontaneous. D is controlled ventilation. So patient is on controlled ventilation. So remember the mnemonic alone. So when you're alone, what do you make? Maggie. So alone person क्या बनाता है? Maggie बनाता है. Maggie. So Magill circuit. Magill. And if you are with your wife or with your sister, बहन, तो क्या है? You can make the biryani. So biryani if you are with someone dependent. So D is bane. So बहन क्या बनाएगी? Biryani. So bane. So remember, A is Magill, B is bane. A is. So that's why if a person is alone doing spontaneous breathing, it is Magill's. And if you are dependent, then we will use. So Maggie, alone, Magill. And what is the other circuit? D is dependent. Dependent means controlled ventilation, bane. So bane, बहन बनाएगी biryani. So dependent. D is dependent. Okay, D is dependent. Very good, Dr. Pratyusha. Perfectly right. Okay. And EF is in children. EF is in children. So what is EF? It is in children. Pediatric cases. Spontaneous ventilation and controlled ventilation. Spontaneous and controlled ventilation. Now we'll discuss the last points. Ambu bag resuscitator. Okay. Ambu bag full form is artificial manual breathing unit. It is different capacity. Children is small, 500, newborn 250, and you can also connect the oxygen to this. So that's why it can be used for normal air also, because it fills. When you press, the air goes to the person's respiratory system and fresh air comes via the inlets. Okay, you can connect it to the oxygen also and reservoir which contain extra air. Okay. Next is Venturi mask, basically for oxygen supplementation through the nasal cannula. Venturi mask can be to maintain the oxygen. So if there's a decrease in oxygen saturation, you can increase the oxygen supply in the patient by giving Venturi mask or the nasal cannula. Let's see that. So oxygen delivery system are classified as basically low flow like nasal prongs, which is 6 liter flow rate, and reservoir, which is bag and mask. Okay, that is a face mask and the bag mask with bag, so bag and mask. And high flow system, this is air entertainment mask or heated system. Okay, they are humidified oxygen delivered through nasal prong. So here we give high flow rates and also humidified oxygen is given. So humidified oxygen is given. Okay, now comes a question. What are the flow rates? Remember, nose. So nose is one nose. It is one nose. So that's why 1. Okay, 1. Then face. Face contain 5 senses, or 5 you can say slap, face 5. So remember, face is 5. And nose is one nose. and face is 5 sensation or 5 openings, 2 nose, 1 mouth, 2 ear, face. Then partial is 10, non-breathing is 10 to 15, venturi is 2 to 15. This was asked recently exam. And what is the percentage of saturation? FiO2. It is 0.24 to 0.44, 0.40 to point. This is up to 100%. One is 100%. So it is 90 to 100%. This is 90 to 100%. So 90 to 100%. Okay. So these are the oxygen delivery system. This is your nasal cannula 1 to 6. I told you nose is 1. Flow rate we give FiO2 25 to 40%. Okay. Then this is face mask which can give up to 5 to 10. Okay. And the flow rate can be 5 to 10, and the fraction of inspired oxygen 40 to 60%. This is face tent. Okay. 10 to 15 liter per minute, and we can use again 40% FiO2. This is our venturi mass 2 to 15 liter, and it is 24 to 60 precisely controlled way. Okay, venturi mass. This is the venturi mass, and this is non-breathing. Okay, non-breathing one. It is 10 to 15. Non-rebreathing, it has a valve to prevent the rebreathing. It is high flow rate is possible, and then this is high flow nasal cannula. So this is a normal nasal cannula. This is high flow nasal. Remember, this is a corrugated tube. So this is a high flow one. We can use up to 100%. So up to 100% and 60 liter per minute can be given through high flow one, through the high flow one. So again, values of photos. So finally, the needles I'll discuss. So this is the Quincase needle, which is used mainly for what? Yes, lumbar puncture and access CSF. Okay, lumbar puncture. Okay, Quincase. So you can see a very straight needle, very straight. This is the spinal Quincase. Then we have epidural one. Okay, it is again long and it goes till the epidural space. Okay, and it puncture ligamentum flavum. Okay, so the most commonly used Tuhis one. Okay, you can see this one. Clear? So this is the Tuhis needle. Okay, yeah, Tuhi. Okay. Now color I'll discuss finally. Inhalational agent. Red is this halothane, blue is this, yellow is SIVO. So what is the color of sher, tiger, save or eat? What is the save? It's yellow. And purple is ISO. So purple is ISO, purple is ISO, purple is ISO. So are you clear? So purple is ISO. Okay, clear? Shoma, there is nothing to explain here. What should I explain you? Red color. Are you getting my idea? मैं रेड कलर में आपको क्या बताऊं? रेड है तो मैं क्यों? So again, these things are, I explain the concept of your MAC, I explain you the concept of the BGS, I explain you malignant hyperthermia, depolarizing, non-depolarizing. अब obviously कई चीजें तो facts ही हैं भाई, उनमें तो मैं क्या करूंगा? ठीक है? Plus I have to finish this also. Okay? It's not like I keep on going on and on. So that is the case. Okay? Now last points. What medication need to be stopped? So remember, MAO-A inhibitors, okay, they should be stopped 3 weeks before the planned surgery. In this particular case, oral anticoagulant, especially warfarin, 4 days prior. Okay, heparin if low molecular weight. Okay, 12 hours before the procedure. Antiplatelets except aspirin like clopidogrel 7 days prior. Thrombolytics, okay, 10 days prior. NSAIDs 48 prior if used with other antiplatelet. I'm just giving this theory. Disulfiram 10 days prior we stop. Okay. All herbal medication 7 days, smoking 2 months or 8 or rather permanently, stop permanently. Antihypertensive, ACE and ARB are omitted, rest can be continued on the day of surgery also. Okay, unfractionated heparin, last dose 4 hours prior to surgery. Okay, and what is fractionated ones or the low molecular ones? If low molecular weight, 12 hours before the surgery. Okay, finally anti-TB till the day of surgery, OHA and insulin, diabetic patients. So diabetic patient on the day of surgery, as patient is fasting, else it can cause severe hypoglycemia. Warfarin 5 days prior to surgery. Warfarin again we have discussed it once again. So again it is 4 days. Warfarin 4 days prior. And finally anti-psychiatric medication except MAO inhibitor till the day of surgery. And what are the only one? The MAO inhibitors. Okay, what are the MAO inhibitors? They are like safinamide. Okay, or MAO inhibitor include our salagelin, rasagelin. They are 3 weeks before that procedure. Okay, so with this we'll finish this file. Okay, so we have covered this in 1.5 hours and covered 3 to 4 questions which are 100% going to be there. So just show you the train of 4 ones. So when you give a non-depolarizing, you get a train of 4. The 4 contraction peak, they are same. Okay, if they decrease, this is called as fading or positive train of 4. If all 4 are diminished, it is negative train of 4. So remember, once again, I'll write here. So if you get decreasing height, this is called as positive train of 4. So this is positive train of 4. This is positive train of 4. What is there in the case of train of 4? So first question, it is positive in non-depolarizing. And if depolarizing, you just get 4 small peaks. This is absent of. That is succinylcholine depolarizing. MCQ. So the question that will be asked. Okay. Succinylcholine. Okay. Let's go back and see once again. Okay. Okay. One more question. What can cause malignant hyperthermia? Which agent can cause malignant hyperthermia? Tell me. Yeah, succinylcholine. What else? Fluorines. And what? And also which agent? Also which agents? Tell me. Yes, also our lignocaine. So these agents can cause malignant hyperthermia. Let's go back to the slide again. This we have discussed. Use of SCH is used for rapid sequence induction intubation. So the use is rapid sequence induction intubation. We use succinylcholine, and also intubation of difficult airway. We can use the succinylcholine, and also short GA needing. Then we do example endoscopy. So for endoscopy also we can use SCH. Okay. This we have discussed already. Okay. This again we have discussed. This is shark fin pattern. Seen in which condition? Shark fin. Again, obstruction. This is our graphs we have discussed already. This capnography. Okay. Now remember, if you get a flat line in capnography, it might indicate a faulty intubation. So you get a flat line, maybe it is wrong. So you get a flat line, maybe it's wrong intubation. Okay. Colors we have discussed already. Color coding of cylinders. Air is gray or black body with white and black quarters in the shoulders. Okay. Oxygen, black body, white shoulder. N2O, blue. CO2, gray. Helium is brown. Okay, is brown. And Antonox is blue body with shoulder which are blue and white quarters. Cyclopropane, orange. These are 6 types of circuits. Maples. AD are adults. AD are adults. BC are not used. EF is children. AD is adult. A is spontaneously breathing, Magill's. D is dependent control ventilation. We use the Bain circuit. What we use here? Bain circuit is used. Okay, this is again the Boyle's apparatus. The ventilation rate maintained is 60 to 180 normally. Okay, this is a ventilator settings. These are vaporizer where you put the canisters. Okay, behind is the gas cylinders. This is the valve systems. Okay, this is the soda lime. Soda lime contain, yes, calcium and sodium hydroxide. They make carbonates and remove the excess CO2 from the circuit. This is the intubation position. This is your endotracheal tube. This is the Murphy eye. Can you see? Bevel inflated cuff, which is there to prevent the aspiration. Double lumen is used for lung surgery. Double lumen, lung surgeries. This is double lumen. Clear? One is tracheal, one is bronchial. So I'm just revising all the point once again. This is laryngoscopy. You can see the larynx close and open, adducted, abducted, both can be seen. This is the sniffing or barking dog position for intubation, called as the chin lift, CL, and head and tail. Remember, head and tail. Remember, head is tilted, chin is lifted. C is L, NLC, CL. Okay. And this is our laryngeal mass, look like the air, not a definitive airway. So we've discussed. This is a Mallampatti score. This is the ASA score. So I've covered everything. So in 2 hours, or rather less than 2 hours, we have covered all the topics of anesthesia. It will give you 3 to 4 MCQs. Okay, I don't know, maybe 1, 2. Next race session, not tomorrow. Tomorrow I have a flight from Chandigarh. So we'll have on 4th, 5th, 6th, 7th, okay, maybe 8th of June. 4 days, and we'll take 4 subjects. So 4 subjects will be taken place. I'll give the names and schedule. Night I'll be making it by looking at my schedule. So 4 subjects. Then I have a 3-day class. Then I'll start again from 11 to 17. So that means we'll be doing it around 15 sessions and covering all important subjects before. I'll give you the schedule today. Okay. Yes, so I'll cover all the important subject, including physiology, patho, plus medicine, surgery, all. So I just need you people to attend and yes, watch, yeah, and do it, yeah. Yes, Dr. Abigail, we will do medicine as soon as possible. So I think in mid-June, we'll do medicine. Medicine, 2 sessions. Okay, so medicine in 2 sessions, okay. Don't worry, I'll take it. Don't worry, okay. Yeah. PDF, I will share the PDF. Don't worry. So PDF is already I've shared this annotated PDF. I will share very soon in the group. So you can watch it there in this case. Okay. So this I'm going to write and give you very, very, very soon. Okay. Fine. Okay. So I will be saving it and sharing it. Okay. So are you clear? So that is the case. Okay, so I'm saving it on the desktop now. I'll put in the group. Okay, chalo, take care. Thank you very much. It is for both NEET PG and FMG exam because the questions remain the same. So don't have to worry about anything. If you attend the sessions, it'll be very beneficial because I'm telling you, self-study is very good. Teachers are the best when they're teaching, like especially anesthesia faculties. They are all very good. I'm not here to teach you a subject. Okay, so I'm just giving you important revision topics. Okay, and I will try my level best to give all things in a very concise and sharp manner. Okay, so main thing is don't waste time, make a schedule, follow it, stick to it, and you will get success eventually in this case. Are you clear? Chalo. So I will be, yes, we'll have images session also, PYQs also, everything will be there. Plus faculties like Dr. Puneet Bhujani will take OBG session. Dr. Ashwini Ranjan, PSM. Okay. And other faculties, Dr. Aman Sethia, so many. Dr. Priyanka, all taking free sessions. Okay. Dr. Priyanka Sasdev. Etc. Free. Okay, so just watch and be there in our sessions. It will be very, very beneficial. Chalo, take care, good night, study hard. Okay, I'm giving you my number. If any doubt, you can message me. So this is the number 777-000-5046. Yeah. So all faculties are very good. So don't have to worry. I'll give you the dates very soon. We are just asked the faculties to give their dates. They will take in the evening time, like 5 to 7 or 8. After that, I will take my session. So you don't have to worry at all. Okay. Bhai, sometime I'm busy. Bhai, I'm working almost 16 hours a day. Sometime I'm not able to reply. So don't feel bad if I don't reply. Okay. Clear? I'm really sorry. Okay. So you can message. I will message 2-3 times. Okay. If I don't reply, message 2-3 times. Okay. So I will be ending the session. Take care. Bye bye. Good night. Let's meet on 4th of June. Okay. 4th June. So I'm ending the session.